Funding for this edition of State of Affairs with Steve Adubato has been provided by the Northward Center. PSE&G, committed to providing safe, reliable energy now and in the future. The Robert Wood Johnson Foundation, the Healthcare Foundation of New Jersey, Johnson & Johnson, MD Advantage Insurance Company, the Russell Berry Foundation, making a difference, the Adler Aphasia Center, enriching the lives of people with aphasia, their families, and communities. And by NJ Best, New Jersey's 529 College Savings Plan. Promotional support provided by NJ On Air. And by CIANJ and Commerce Magazine.
Welcome, folks. This is Steve Adubato. There is not a parent out there. There are not students out there concerned about our schools. What are we going to do next? We're actually taping in the latter part of September, and we're honored to be joined by the Superintendent of the Newark Public Schools, Roger León. Roger, good to see you, my friend.
Good morning, sir.
So 37,000 students in the Newark Public Schools, correct?
Well, we have a total of 55,000 students in the city of Newark that attend what people understand to be the district schools, charter schools, private and parochial schools in our great city.
So, and are they all living under the same edict in terms of remote learning?
We're making sure that there's guidance that's being provided to everyone with the understanding that I govern over the district schools.
Now, Roger, we've talked many times about education. We have a collaboration with our Stand and Deliver program, which teaches and mentors young people on their public communication and leadership skills. So what I'm really curious about is this. When it comes to communicating, when it comes to connecting with students, what are some of the biggest challenges that teachers face using this technology to connect with their students? And then we'll talk about the students, or maybe it's the same issue.
Well, we understand that the realities of today, no one actually prepared for. However, what we're actually doing is seizing what we are learning to actually provide a better instructional program for children in the future. So we know that in the spring, both teachers and schools and families and students did an incredible yeoman's task of really adjusting from a paper packet, which was the first thing that they did 3 weeks. And we've been virtual ever since April 6th. So continuing that becomes extremely important. Difference between that and the digital divide is extremely important to highlight. We know that if you don't have the technology, there is no conversation occurring virtually. However, the digital divide speaks to also that the discourse in classrooms and children speaking with classmates all across the world is what the digital divide is all about. And this has pushed us to a point where we're required not to wait until that point in time to adjust. We're being obviously asked to adjust right now. And I think we're doing a really, really good job. We've changed a lot of our curriculum offerings to address the realities of today.
Roger, let's talk about the divide a little bit more. So the divide means a lot of things, the gap, if you will, between those who have the technology, those who have high-speed internet access, and a significant thousands of your students, millions across this country that do not have high-speed internet access, do not have the kind of computer that's necessary to learn remotely. Question, in the Newark schools, does every student have a computer, and is it a new computer, used computer, and what are the issues there?
Yeah, so I think at the heart of your question, we're talking about the opportunity gap that exists, not only in our city, not only amongst wards, but in the city in contrast to other municipalities in our great state, and obviously the state in contrast to the country. and the world. So the answer to the issue about technology is that the answer actually varies. There are some students who have actually received new computers. That is true. There are students that are utilizing a used computer. That's also true. And then there are students that were issued a computer last school year, and we've asked them to not turn it in at the end of June. So they're continuing to use the same computer that they received last year. So we technically have all of the answers to be true there. I would want to share with you that part of the objective of previous administrations was to get as close to one-to-one as possible. And so in that transition period, what has occurred has been the purchase of Chromebooks in a particular school for a particular grade. What we're doing today is creating a system-wide approach to the actual distribution so that new Chromebooks would be issued to a particular targeted grade. Let's say in the future for next school year, it'll be targeting students who are entering 9th grade. And then all of the other Chromebooks would be redistributed across all of the other grades. Each Chromebook has a lifespan of 5 years. So ultimately, if a student is in 1st grade and they have a Chromebook that only has a 2-year lifespan, it would be more appropriate to issue that book to an 8th grader in the following year because it would only have 1 year left.
But Superintendent, let me follow up. First of all, could you go back? I'm going to go back to this question because you said next year. So my sense is there's an anticipation that remote learning may be in the picture for a while, regardless of the vaccine issue, regardless of where we are. Is that a fair assessment?
I'm glad that you asked that. No, I want to be super clear that what has, unfortunately, sometimes it takes a crisis for everybody to awaken and to see that things need to occur differently. So I'm suggesting that come next year, when this pandemic is a lot more behind us than what it is even today, that we will be seizing this virtual reality as part of a norm that contributes to our academic program. It's not that we needed a crisis to realize this. I think we were moving in this direction anyway.
It sped things up though, Roger, right?
The crisis got us here a little quicker.
Go back to the, I got a couple minutes left. Could you go back to the high-speed internet issue? Because you don't control that. There are a lot of other variables there, but you are, more importantly, not just you, but your students and teachers affected by it. Where are we with high-speed internet access in the city of Newark?
Absolutely correct. So anybody who actually needs a Chromebook from us, just to highlight the point really quickly, would definitely need to report to their particular principal or their classroom teacher. One of our realities is that there are schools that don't have them in stock in the building, but the district has the distribution of resources where we would actually move a Chromebook from one school to a student that needs one in another school that may not have any in stock right now. As it relates to the internet, any student issued a Chromebook, we've already purchased through the CARES Act funding monies to accompany internet. So if you utilize one of our Chromebooks, we're actually paying for the internet access.
You say that again, if what?
So if you utilize one of our Chromebooks, so our Chromebooks are being offered to students and they borrow them. If you are using a Chromebook, unlike you're using your own computer at home. If you're using your own computer at home, you already have some type of internet
That's right.
with some company, whether it's
whomever, right. But if it's issued by the Newark Public Schools, then you will do what for those students?
Pay for the internet access. So we've made we have a contract with Altice that contributes a certain amount of the dollars from the CARES Act funding. We budgeted not only for the Chromebooks, but also for the internet access. So a student who borrows our Chromebook gets internet access free.
Roger, let's do this. We are taping at the end of September. Let's make sure that we have you back as we go into right after the new year, see where we are, into the spring semester. I'm talking about college semesters, but that'll be a different time. We'll see where we are. We'll check back in. But most importantly, to you and all those 50,000 plus students and the teachers connected to the city of Newark, we wish you all the best. Thank you, Roger.
Thank you so much. We appreciate you.
I'm Steve Adubato. That's Roger León, and we'll be right back.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
Welcome back, folks. We're now joined by our longtime friend. He is Dr. Ben Dworkin, director of the Rowan Institute for Public Policy and Citizenship. We do a series of segments with them about citizenship, about public policy, about what it means to be a good citizen. Particularly, we're doing this at the end of September as we get into the 2020 election, or the 2020 election is happening. Ben, let me ask you this. How important is citizenship, good American citizenship, now more than ever?
It's critical. It's critical, Steve. First of all, thank you for having me back. But citizenship, active citizenship, is critical. I think regardless of where you fall on the political spectrum, the issues all affect us. The issues that are being debated today have real effects on families and individuals, on our future. And if you don't get involved, if you're not a citizen, then somebody else is making those decisions for you. And this is why everybody needs to exercise the right to vote and to participate as much as possible in our democracy.
So, you know, we're going to show this before and after the 2020 election, because we don't do horse race. We don't do, hey, who's up in the polls, because that's not what interests us. We're interested in policy. We're interested in leadership and citizenship. So that being said, you said vote. The whole question of the voting and electoral process up in the air. The President Trump, saying it's already rigged, it's set up to be fraud, and the mail-in voting is ridiculous, and everyone should go to the polls. Just the process of how we vote and whether people believe in the outcome is huge. No?
It absolutely is, and I think it is unfortunate that some leaders have raised the specter of illegality in terms of the voting, because the fact is we really don't see it. Every study has shown, certainly things like vote by mail, you just don't see widespread fraud. We have several states that have been doing this for years: Utah, Oregon, Washington. These are places that have been doing all vote by mail, like New Jersey is emphasizing this year. It's not exclusive to it, but it's emphasizing a vote by mail election. That, we have not seen evidence of fraud. So it is unfortunate that I think people are losing or questioning their confidence in the system. It really is misplaced.
So let me press it even further, Dr. Dworkin. By the way, Steve Adubato, Dr. Ben Dworkin at the Rowan Institute for Public Policy and Citizenship. Ben, I've got to ask you, there will be a significant number of people, regardless of who wins this presidential election, who will question, seriously in some cases, whether that person should be or is the president of the United States. Are we potentially facing a constitutional crisis?
Yes. I think any rational observer, given the kinds of rhetoric we have seen on both sides of the aisle, the kinds of information and reports that we've seen about foreign influence, will question it. But we've been questioning it. The fact is, after 2000, we had millions of people who questioned the legitimacy of George W. Bush, who won that election. After 2016, you had people who questioned the legitimacy here of Donald Trump. After 2008, you had people who questioned whether Barack Obama was even eligible to vote, and you had the whole birther movement. And those
I'm sorry for interrupting, Ben, but there was a peaceful transition of power. There's a question as to whether there will be a peaceful transition of power if President Trump loses, and people will determine what that means. And I don't even know if we'll find out on November 3rd, or a week later, 2 weeks later, a month after. So here's what I have to ask. Citizenship, what does that mean to be a good citizen if the president, who may lose, chooses not to leave office? What do citizens do?
I think the first thing citizens do is that they have to participate and vote. And then we have to count on the president or whomever loses the election to be a good citizen themselves and to step away once the votes are counted. And yes, you're right, it might not all be done on election night. We might go to sleep on November 3rd and simply not know. Only we would only have a portion of the vote that has been counted. But still, everybody has to be a good citizen and therefore follow the basic tenets of the peaceful transition of power, a distinct feature of American politics that has allowed us to, and this democratic experiment, lowercase d, democratic experiment to exist for over 230 years. Everything is at stake and everybody has to act properly.
So I'm curious about this, the role of the media as it relates to not just this election, but elections moving forward and helping our citizens better understand what the facts are, right? And making sense of all that. To what degree are you concerned, Dr. Dworkin, that not only are we polarized and divided as a people, but the media is polarized and divided as well, meaning people go to the sources that they choose to go to reinforce whatever it is they think they believe?
It's a huge concern. We don't have, we're in an era where people refer to alternate facts. We're in an era where the media has decided it's like the early 1800s, that's Jacksonian democracy. That is, you make more money hyping your political views and your partisan standpoint than you do if you try to give a more reasoned and centrist, for lack of a better word, set of facts. These, because it's an issue of economics and capitalism, and people realize once people saw that Fox can make money doing it, so MSNBC understood that they could can make money in their own way with their particular viewpoint, and they have found an audience. So it's a huge deal. The media, like every individual, are citizens of this country, and they have to play their role. And that means on election night, if the vote hasn't been counted yet, don't call the race. Don't sit there and throw up red states and blue states until we really know. And you have to hope that people will act properly in this kind of thing. Now, one of the things we've seen is that with the advent of the internet and the way we're talking today, the media is a much larger thing. Everybody can put up a blog, a post, different things, and become effectively a media outlet. And I think we just have everybody to exercise some caution before they just listen to whatever comes across their newsfeed.
Ben, let's do this. By the way, we're doing these segments in cooperation with the Rowan Institute for Public Policy and Citizenship. You've been listening to Dr. Ben Dworkin.
Thank you, Steve. I always appreciate it.
You got it. I'm Steve Adubato. I'll be right back.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
We are now joined by Dr. Chris Pernell, Chief Strategic Integration and Health Equity Officer at University Hospital. Good to see you, Doctor.
Good to be here.
Doctor, do this for us. Define health equity, please.
Sure. So whenever I talk about health equity, I go according to the APHA, the American Public Health Association's definition, because I think it's spot on. It is the opportunity for all persons to reach the highest level of health, their highest and greatest potentials to be equity. It is an ambitious definition, but it is a definition that really puts health equity where it should be, aspirational.
You know, when we talk about health equity, a lot of talk as we do this program at the end of September 2020, it'll be seen after that. A lot of talk about these trials, these clinical trials. Where are we with the vaccines? The number of Black and brown Americans who are included in those trials is disproportionately too low, while the number of cases of COVID for those who fall into that same category is way too high. It's a health equity issue, is it not?
Yes, it is. It's spot on. I tell people we have decades worth of health disparities research and literature that tried to describe and, let's say, paint the severity of the issue around health equity for folks. But I think we've learned more as a nation in these past 6 months by the destructiveness of this coronavirus pandemic and how Black and brown communities have been disproportionately impacted. I don't think it's possible for anyone to deny the barriers that exist to the reaching the full potential of health for all persons. What we've seen is, as a friend of mine, good friend, describes, those fissures in societies became earthquakes, and that's where we're seeing the devastating impact of.
So as our team puts up the Confronting Racism, a long-standing series that we are committed to doing, I'm not even going to say how long, because the fight will continue. So as we put this under the category of confronting racism, talk to us, Dr. Pernell, about why the issues you just described are in fact issues of institutional and structural racism.
Great question. So I like Dr. Cameron Jones's definition of racism, and I want to start there. She is a leading thinker in preventive and public health medicine. And so Dr. Jones describes racism as a system of structuring opportunity whereby one group is advantaged and another group is disadvantaged based on phenotypic differences, meaning what they look like, but the strength of the society as a whole is sapped. So if we understand racism is actually system sickness, and that system sickness impacts what we call the social determinants of health, right? So that system sickness impacts where groups live. If you could think about historically about redlining, right? Certain impoverished, disenfranchised geographic regions where Black and other communities of color were actually forced into by being locked out of economic opportunity. If we think about the substandard housing that Blacks and Browns live in poorer communities, if we think about that crowded housing, if we think about where folks work. There was a recent article that posted by a researcher out at UCLA that cited US Census data that said that Blacks and Latinos comprise approximately 43% of the service and production industry, right? So those are those essential workers working in frontline positions where they did not have the luxury or the privilege to work from home, right? Because of the nature.
Like me, I'm working from home. I'm broadcasting from home.
Yes.
Not everyone has that.
Not everyone has that. And how I describe it is, households under threat, right? When I say under threat, under economic threat, loss of income is destabilizing. It's destabilizing, I should say. So that's how system sickness, also known as structural racism, impacts health outcomes, because it impacts the type of job you work. It impacts the wage you earn. It impacts the type of housing that you live in. It impacts what your neighborhood looks like, whether you have clean air or whether you have sidewalks that are walkable. There are so many things that are tied into the outcomes that we see. And it's not until we have those conversations about those upstream factors can we really get at solutioning.
But a couple of things. Check out our previous interviews with Dr. Sharif El-Nahal, the CEO at University Hospital, one of our healthcare and hospital partners, and also a series of interviews we've done with one of our board members, Micheline Davis, up at RWJ Barnabas Health. We talk about social determinants of health. But let me ask you this. By the way, this is personal for you, doctor, is it not?
Definitely personal. So unfortunately, I lost my dad to this pandemic on April 13th. My dad
I'm very sorry.
Thank you, Steve. My dad was a hero to so many, right? Because he was a young Black man coming up in the Jim Crow South. My dad got a position at the famous Bell Labs, but he got a position on the grounds crew. But because of his tenacity and others recognizing talent within him, he ascended the research throne and became a member of technical staff, which was reserved for Ph.D. scientists. So my father was this man who lived a life of defying the odds, lots of chronic health conditions, and he couldn't escape the pandemic, right? He got exposed and his body just could not fight it. And in addition to losing my dad to coronavirus, my oldest sister, who is a breast cancer survivor, she too got infected. And just think about it, Steve. My dad died on the 13th of April. We had a virtual service for him toward the end of the month. The day that we had the virtual service for my dad, I believe is when my sister found out that she was positive. And she's been going through a very long and harrowing battle trying to overcome. So this is definitely personal for me. And when people say how coronavirus or COVID-19 has disproportionately impacted Black and Brown lives, I like to use myself as an example. 2 people in my family infected, 1 died, and 1 a long hauler trying to overcome.
I'm going to let you do this in the last minute we have. We're doing this before the November 3rd election. This isn't about politics. It's not about the election. As we do this program, 200,000 people have died, including your dad. President Trump recently said in a speech, virtually no one has been affected.
That's so hard to hear. It's actually infuriating. It's disrespectful to the humanity of those Americans who've lost their lives. Look, we've lost more Americans than we've lost in every world war other than World War II or the American Civil War. That is a staggering number, and that is something that the president and no one can escape. And the fact that we have those in government, especially at the federal level, who can be dismissive as if these lives don't matter, as if these lives hold less dignity, it's atrocious. And I think it's put a greater fire in my belly to make sure people understand, how do you truly achieve health? You achieve health by voting. You achieve health by those social determinants of health that we described previously. So this is a personal fight, and I'm going to keep telling it, and I'm going to keep impressing upon our community and all communities the need to be informed, educated, and involved.
Dr. Chris Pernell from University Hospital, I cannot thank you enough. And by the way, for anyone watching right now who's asking or wondering, why would Adubato even raise that quote? Don't know what's going to happen in the election. You'll see this after. It's because people who are in public life, whether you agree with them or not, they influence our view of important, critical life and death issues like COVID. That's why. Thank you, Dr. Pernell. We appreciate you joining us, and we wish you and your family all the best. I'm Steve Adubato. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Northward Center, PSC&G, the Robert Wood Johnson Foundation, the Healthcare Foundation of New Jersey, Johnson & Johnson, MD Advantage Insurance Company, the Russell Berry Foundation, the Adler Aphasia Center, and by NJ Best. Promotional support provided by NJ On Air, and by CIANJ and Commerce Magazine.
What is your child's dream for the future? Doctor? Teacher? Architect? Whatever they aspire to be, a college education may realize those dreams. And NJ Best can help. It's the college savings plan specifically designed for New Jersey families. Start saving today with as little as $25, because now is the time to invest in their future. To learn about NJ Best 529 College Savings Plan, its investment objectives, risks, and costs, read the Investor Handbook available at njbest.com.